Around this time last year is when COVID-related hospitalizations started increasing. Scripps Health's chief medical officer, Dr. Ghazala Sharif, says about a week ago they had 52 COVID-positive patients, and now it's risen to just over 80.
So we're tracking, unfortunately, at the same rate as we were last year. So we do expect that surge to come right after the holidays. Just rinse and repeat. We've done this before, right? So this is what we see after holidays. So 2 weeks from now, we should see that next surge.
Flu cases were low last year, but this November is seeing the most cases in at least a decade. At Scripps alone, flu-related hospital admissions doubled in the last week.
So if you think about hospitalizations in general, if we're going to be seeing that volume of COVID patients and add on the flu patients that we have, that could very easily overrun the healthcare system.
In years past, high COVID admissions meant some surgeries had to be postponed, but Scripps is hoping to avoid that.
We're trying to get, as we call it, preloading, trying to get as many surgeries as we can done before that wave hits.
But we're ready for it. The hospitals at this point are not overwhelmed as we were a year and 2 years ago.
Joshua McCabe is Director of Emergency Services at Sharp Memorial Hospital. He says COVID hospitalizations remain relatively low, but they're also preparing for the worst. At the same time, emergency room visits for influenza-like illness are trending up. McCabe estimates as many as 30% of patients are coming in for that reason, but they don't always have to seek emergency care.
Essentially, most people that are presenting with ILI or influenza-like illness, a viral illness with fever, aches, generally they don't need an emergency room. There's really not that much we can do for them in the ER.
If there's that level of concern where there's true shortness of breath, fever that you can't break, neurologic symptoms, anything like that, you should absolutely come to the emergency department. But if you're just part of what we call the worried well, where you're worried about exposure, that's probably not the best place for you to go to at this time, given the volume that we're seeing.
COVID, the flu, and RSV have health officials concerned about a tripledemic this winter. RSV is a respiratory virus that typically impacts young children. It was surging last month, but Rady Children's Hospital officials do say cases are trending down. They're also seeing more kids coming in with the flu. Health officials are encouraging residents to stay up to date with influenza and the bivalent COVID vaccines.
So we still have a Christmas and New Year's. We still have a chance to not get back where we were last January. But that's only if everybody pitches in and does their part.
Matt Hoffman, KPBS News.